Hi, I'm Dr. Mark Wheaton, physician, owner of Lakeside Sports and Pain Clinic with clinic locations in Excelsior and Monaga, Minnesota. So today I am going to introduce another topic to you in the field of musculoskeletal medicine, and it's a treatment called Platelet Rich Plasma, otherwise known as PRP. Now, by now most of you are familiar with prolotherapy on some of the other shows that I've done. And prolotherapy, of course, being a treatment that has been used for decades for problems that involve injuries to many joints and the neck and the back and the body. Prolotherapy has been very successful in stabilizing joints for many of my patients. It's a phenomenal treatment and the one I rely on most often. But there's also other treatments that are also natural that have the capacity to add additional healing or act as a, if not a substitute for, a companion to prolotherapy. So what I mean by that is PRP is really a treatment that is better thought of as prolotherapy using your own blood. Prolotherapy uses solutions to help heal injuries and damaged ligaments, whereas PRP uses your own blood to do much the same. So the way it works is a person is evaluated, so I'll see a patient and I will determine if they're a good candidate for PRP by examining their joints, hearing a history, and seeing where the pain is coming from. So after I give them a diagnosis, and let's just say it's a rotator cuff tear or injury, or it could be a tear in the meniscus of the knee, or it could be an ankle injury, a ligament tear, many things it could be. And so once I made the diagnosis, I determine if they're a good candidate for the procedure of PRP. So the next step is I'll have my nurse draw their blood, and that person will wait for about 14-15 minutes while the blood is spun in a centrifuge. A centrifuge is just a fast-moving rotational device that spins the blood into layers, so that at the end of the spin cycle there is a very fine layer of cells called platelets. And platelets are, as the name Platelet Rich Plasma designates, they're rich in platelets. And the platelets are very high in growth factors. Growth factors are in abundance, and they are the main drivers of repair and healing in the body. So when the process is done, those platelets are extracted and then they are injected into the area of damage. Wherever the injury is, they're injected at the source of whether it's a rotator cuff tear or a meniscus. Or maybe it's plantar fasciitis, it could be a low back disc problem. A lot of different diagnoses can be treated with PRP. So the process ensues right from the time of the injections and will go on for a number of weeks. And it's not a quick fix. Just like prolotherapy takes some time to develop new tissue, PRP is much the same way. One thing that I really want to stress with both prolotherapy and PRP is that there's very little downtime. In contrast to surgery, where there's oftentimes weeks to months to wait before you can be active again, literally it's days. In some cases, after a treatment, within a day or two, most of the soreness and stiffness is gone. So if you need to go back to work in a day or two, fine. If you have a job that's particularly stressful on your shoulder, and we've done PRP in your shoulder, well, you might want to take it easy for the next day or two before you use that shoulder again. But in most cases, very little downtime, and you can get back to your activities really quickly, and that's a great plus for people that are active or have jobs that they can't take time off for. But the process is very well tolerated. It only takes a few minutes, and it can be done multiple times depending on how bad the condition is. And at the end of it, whether the person has 1, 2, 3, or 4 treatments, a person can be improved to the point of being totally free of pain, back to functioning, back to serving the tennis ball, hitting that golf shot, being able to do their gardening, and the results can be absolutely phenomenal. Now, I'm going to say one thing that a lot of practitioners don't do that I think is very important when it comes to deciding who will be a good candidate for PRP. And if stability is not assessed, or maybe a better way to put it, if there is instability of a joint and it's not treated with prolotherapy first to stabilize the joint, then the PRP can be wasted because that movement, excess movement in the joints, can destroy the cells in the blood. So I like to assess for stability, and once I determine if the person is stable or unstable, then I either go ahead with the prolotherapy or the PRP if the person has good stability. Now the question might be asked, what specifically does PRP treat and fix? It's really good for arthritis, and many people have arthritis, especially the aging population. So when you talk about arthritis, you're talking about worn cartilage. PRP has the capacity, through the use of the growth factors and the platelets, to stimulate repair of a lot of the cartilage damage that a person has in their joint. And in so doing, the pain can subside without the destructive aspect of cortisone. Otherwise, soft tissue injuries like tendon tears, ligament tears, incompetent ligament structures, can all be treated very successfully with PRP. And I'll add too that because you're using the person's own blood, it has a great capacity when relocated to the damaged tissue, such as a meniscus tear in the knee. It immediately can go to work at that area, and of course you don't have to worry about any cross-reactivity or problems accepting the tissue that comes right from your own blood. But the final analysis that prolotherapy and PRP are excellent treatments, far better than living on pain medications, cortisone shots, which are very destructive to your joints, and certainly a better option than doing surgery. So I would like to encourage you to look into PRP. You can look at it online. There's many good studies out. Many of them have now proven that prolotherapy and PRP is very beneficial for the treatment of soft tissue and musculoskeletal and sports-related injuries. If you would like to contact us, please feel free to call us, or you can contact us via our website, drmarkwheaton.com. So don't live with your pain anymore. You can get rid of your pain in a natural way and go back to enjoying the life that you once had. Thank you for listening.